Back pain is a common problem that affects millions of people. To manage the pain, doctors often prescribe opioids, powerful painkillers that can have serious side effects. These side effects can include addiction, overdose, and even death. In recent years, there has been a growing epidemic of opioid addiction, and many people are looking for safer and more effective ways to manage their pain. Traditionally, back pain treatment often involves a combination of physical therapy, over-the-counter pain relievers, and in severe cases, prescription opioids. While these approaches can provide temporary relief, they often come with significant drawbacks. Physical therapy can be time-consuming and costly, while over-the-counter pain relievers may not adequately address severe pain. Opioids, on the other hand, carry the risk of addiction, tolerance, and a range of debilitating side effects. The dangers of opioid overuse and addiction have become increasingly apparent, leading many patients and healthcare providers to seek alternative pain management solutions. This is where cannabis has emerged as a promising option, offering a potentially safer and more natural approach to alleviating back pain and reducing reliance on opioids. As we delve deeper into the world of cannabis and its applications for back pain, it's essential to understand the different types of pain this plant can address. By understanding the specific ways cannabis interacts with our bodies, we can better appreciate its potential to provide much-needed relief for those suffering from this debilitating condition. Cannabis can be used to treat different types of back pain, including chronic pain, nerve pain, and muscle spasms. Chronic pain is long-term pain that lasts for more than 3 months. Nerve pain is caused by damage to the nerves, and it can be sharp, shooting, or burning. Muscle spasms are sudden, involuntary contractions of the muscles, and they can be very painful. Each of these types of pain arises from different underlying mechanisms, and cannabis offers a unique advantage in its ability to target multiple pain pathways simultaneously. Chronic pain, often associated with inflammation and tissue damage, can be effectively managed by the anti-inflammatory properties of certain cannabinoids found in cannabis. These compounds work by reducing inflammation at the source of pain, providing long-lasting relief without the harmful side effects of traditional anti-inflammatory drugs. Nerve pain, on the other hand, requires a different approach. Cannabis contains compounds that can modulate the transmission of pain signals along nerve fibers. This means that the intensity of pain signals reaching the brain is reduced, providing relief from the often debilitating effects of nerve pain. This is particularly beneficial for individuals suffering from conditions like sciatica, where pain radiates along the sciatic nerve, causing shooting pain down the leg. Muscle spasms, often triggered by muscle overuse, injury, or underlying medical conditions, can also be effectively managed with cannabis. Certain compounds in cannabis possess muscle relaxant properties, helping to alleviate the painful contractions and stiffness associated with muscle spasms. This can be particularly helpful for individuals who experience back pain as a result of muscle tension or injuries. By understanding the specific type of back pain an individual is experiencing, healthcare providers can recommend tailored cannabis-based treatment plans that address the root cause of the pain, providing more targeted and effective relief. Cannabis contains compounds called cannabinoids that interact with the body's endocannabinoid system, or ECS. The ECS is a complex system of receptors and neurotransmitters that plays a role in regulating pain, inflammation, and other bodily functions. When cannabinoids bind to ECS receptors, they can help to reduce pain and inflammation. To fully grasp the therapeutic potential of cannabis for back pain, it's crucial to understand the intricate workings of the endocannabinoid system. This system, present in all of us, plays a crucial role in maintaining homeostasis, or balance, within our bodies. It does so by regulating a wide range of physiological processes, including pain perception, inflammation, mood, sleep, and appetite. The 2 primary cannabinoids responsible for the pain-relieving effects of cannabis are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC is the psychoactive compound in cannabis that produces a high, while CBD is non-psychoactive and does not produce a high. Both THC and CBD have analgesic or pain-relieving properties, but they work in different ways. THC binds to cannabinoid receptors in the brain and spinal cord, blocking pain signals from reaching the brain. This is similar to how opioids work, but THC is much less addictive and has a lower risk of overdose. CBD, on the other hand, does not bind directly to cannabinoid receptors. Instead, it interacts with other receptors in the body that are involved in pain and inflammation, such as the vanilloid receptor 1 or TRPV1 receptor. The TRPV1 receptor is involved in transmitting pain signals to the brain, and CBD has been shown to desensitize this receptor, reducing the perception of pain. Additionally, CBD has potent anti-inflammatory properties, which can further contribute to its pain-relieving effects. Inflammation is a natural response to injury or infection, but chronic inflammation can lead to pain and tissue damage. By reducing inflammation, CBD can help to break the cycle of pain and inflammation, providing long-lasting relief. Section 4. Finding your fit navigating cannabis products for back pain. There are many different cannabis products available, so it's important to choose one that is right for you. Some popular options include: this is the most basic form of cannabis, and it can be smoked, vaped, or cooked into edibles. Flower that is high in THC will produce a psychoactive effect, while flower that is high in CBD will not. Oils and tinctures are concentrated extracts of cannabis that can be taken orally or applied topically. They are a good option for people who want to avoid smoking or vaping. Edibles are food products that have been infused with cannabis. They can take longer to take effect than other methods of consumption, but the effects tend to last longer. Topicals are creams, lotions, and salves that are infused with cannabis. They are applied directly to the skin and can provide localized pain relief. When choosing a cannabis product for back pain, it's important to consider the following factors. If you are experiencing mild pain, a low-dose product may be sufficient. If you are experiencing severe pain, you may need a higher dose or a different type of product. Do you want to experience a psychoactive effect, or do you prefer to avoid it? THC-dominant products will produce a high, while CBD-dominant products will not. How do you prefer to consume cannabis? Smoking, vaping, and edibles all have different effects and drawbacks. Ultimately, the best cannabis product for you is the one that you find most effective and enjoyable. It is always advisable to consult with a healthcare professional or a knowledgeable cannabis counselor to determine the appropriate product and dosage for your specific needs. They can provide personalized guidance based on your medical history, the severity of your back pain, and other relevant factors. Section 5. Starting your journey. A guide to cannabis for pain management. If you are considering using cannabis for back pain, it is important to start slowly and increase your dose gradually until you find what works best for you. It is also important to be aware of the potential side effects of cannabis, such as dry mouth, dizziness, and anxiety. Here are some additional tips for using cannabis safely and effectively for back pain. Before starting any new treatment, it is always a good idea to talk to your doctor. This is especially important if you have any underlying medical conditions or are taking other medications. When starting cannabis for the first time, it is important to start with a low dose and increase it gradually as needed. This will help you to minimize any potential side effects. The effects of cannabis can take some time to kick in, especially when consuming edibles. It is important to be patient and wait at least an hour before consuming more. If you are experiencing any psychoactive effects from THC, it is important to be in a safe environment where you can relax and avoid any potentially dangerous activities. Everyone reacts to cannabis differently. If you experience any negative side effects, stop using cannabis and consult with a healthcare professional. Remember, cannabis affects individuals differently, and finding the right approach is a personalized journey. It's crucial to listen to your body, be patient, and adjust your consumption method and dosage as needed, always prioritizing your health and well-being. Section 6. A safer path. Choosing cannabis over opioids for back pain. Cannabis offers a potentially safer alternative to opioids for back pain management. Unlike opioids, cannabis is not addictive and has a very low risk of overdose. Additionally, cannabis does not come with the same risk of serious side effects, such as respiratory depression, constipation, and addiction. The opioid epidemic has highlighted the urgent need for safer and less addictive pain management options. Cannabis, with its long history of medicinal use and growing body of scientific evidence supporting its efficacy, has emerged as a beacon of hope for many seeking relief from chronic pain, particularly back pain. One of the most significant advantages of cannabis over opioids is its safety profile. While opioids carry a high risk of addiction, overdose, and potentially fatal respiratory depression, cannabis has a remarkably low toxicity profile. In fact, there has never been a reported case of a fatal overdose from cannabis alone. This makes cannabis a much safer option for long-term pain management, especially for individuals at risk of opioid addiction or those who have experienced adverse effects from opioid medications. Furthermore, cannabis offers a more holistic approach to pain management by addressing not only the pain itself, but also its underlying causes. Many chronic pain conditions, including back pain, are often accompanied by inflammation, muscle spasms, and anxiety. Cannabis, with its unique combination of analgesic, anti-inflammatory, muscle relaxant, and anxiolytic properties, can target these multiple facets of pain, providing comprehensive relief and improving overall quality of life. Section 7. Embracing a holistic approach. While cannabis can be an effective tool for managing back pain, it is important to remember that it is not a cure-all. It is most effective when used as part of a holistic treatment plan that includes other therapies such as physical therapy, massage, and acupuncture. By integrating cannabis into a comprehensive pain management strategy, individuals can experience synergistic benefits that extend beyond pain relief. For instance, cannabis can enhance the effectiveness of physical therapy by reducing pain and inflammation, allowing for greater range of motion and more productive therapy sessions. Similarly, cannabis can complement massage therapy by relaxing muscles and reducing tension, promoting deeper tissue manipulation and enhanced pain relief. Furthermore, incorporating lifestyle modifications such as regular exercise, stress reduction techniques like yoga and meditation, and a healthy diet can further optimize the benefits of cannabis for back pain management. Regular exercise strengthens muscles supporting the back, improving posture and reducing the likelihood of pain flare-ups. Stress management techniques can alleviate muscle tension and reduce pain perception, while a balanced diet rich in anti-inflammatory foods can further support pain reduction and overall well-being. In conclusion, cannabis offers a promising alternative to opioids for managing back pain, providing a safer and potentially more effective approach to pain relief. By understanding the science behind cannabis, exploring different product options, and embracing a holistic approach to treatment, individuals can harness the therapeutic potential of this ancient plant to regain control of their lives and live pain-free.